Hello and welcome to Road to the Global Mental Health Community Summit. I'm Roy Sternin and I can't be more excited to kick off this podcast mini-series with you. I'm incredibly honored to be co-hosting the Global Mental Health Community Summit again this year. It's all about redefining mental health together. Boehringer Ingelheim is bringing together 60 of the most inspiring and motivated mental health advocates for 3 days of connection, idea sharing, and action towards meaningful change. It's going to be incredible. But the best part, I'll be taking you behind the scene to share the incredible magic, challenges, and everything in between. In each episode, I'll interview some amazing people who will help us shape this year's event, featuring incredible guests involved in building #GMCS25. Join me as we hit the road to the summit together. Hey, welcome again. Thanks for joining in for our last episode in our mini-series. In the last episode, I was chatting with Falk Schuster, a fellow patient advocate, talking about how to bring insights from patient advocates and patient communities into the drug development process. It was a wonderful chat, and I really recommend that if you haven't listened to it yet, you do it too. In this episode, I'm very happy to welcome Aileen Rice-Jones. She's the head of public affairs for mental health at Boehringer Ingelheim. It's the first time she's joining us in planning this summit, and I'm super excited to have her. She might be new to Boehringer, but she brings wealth of experience in her field. Hi, Aileen.
Hi, Roy. Lovely to meet you.
Lovely to meet you too. Could you tell us something about yourself before we dive in?
So a bit about myself. So I have a long background in policy and public affairs across health generally. So looking at all different health conditions. I used to work with Boehringer in my previous job supporting on events like this. And so it's super exciting to be part of it on this side. My first few months have been really busy. We've been to Geneva at the World Health Assembly, and I'm still trying to learn German 6 weeks in, but it's only been 6 weeks, so...
I think you have a long way to go with German. I'm still trying my best after 5 years in Austria. I wanted to ask you about our theme, kind of diving in.
Yeah.
We are talking about redefining mental health together. And as you're already starting to land in Boehringer, surrounded by your amazing peers, I think that it's not just a theme, redefining mental health together, but really a collaborative effort involving patients, patient groups, and other stakeholders to really understand unmet needs and come up with solutions. What do you think about this theme, redefining mental health together?
That's a really great question, and I think you could ask 100 people and get 100 answers, but I will give you mine. So I think from my perspective and from our perspective at Boehringer, I think for us, the together is really key. I think the theme of this meeting and of the high-level meeting really shows that mental health is everybody's issue. It's not just, one country, one person. It is a global issue. So that's where the together comes in. On the redefining part, I think it's really important that we start to look beyond mental well-being and we start to really focus on those serious mental illnesses that I know so many people across the world have.
As somebody who suffers from complex PTSD, I'm really hoping to have better therapies in the future, and that this kind of widening of the focus from mental well-being to mental health will cover serious mental illness as well.
Yeah, 100%. And that is something that Boehringer, we're working towards as a company, and something I know we're all striving for, both for greater innovation in mental health, but also for that serious mental illness to be really included at the global level.
And do you think that redefining mental health together is something that we kind of say because we bring people together to the same room, or is there something tangible in terms of public affairs that can be taken directly from the summit and can be implemented?
Yeah, I think we are, as a company, Boehringer is really, really focused on how we bring the global to the local and vice versa. I think we all need to be both the base of the pyramid, but also try and influence the tip and just push anyone and everyone who listen to make that change. And I think that's where we collectively can all together redefine mental health.
Thank you. And I can't wait to be at the summit and meet all those people, share the ideas, and really start making this change together.
Yeah, no, me too. I'm really excited to be there and feel the buzz in the room. I've heard so much about it, so really looking forward to it.
As you know, day 3 of our summit is all around the UN's high-level NCDs.
And mental health.
Yes, about mental health, of course. Can you firstly explain what it is and a bit more about what we're trying to achieve?
Yeah, absolutely. So the UN high-level meeting so each year there's a different theme. So this year the theme or the title of the meeting is NCDs and Mental Health. I think this is the first time ever that mental health has made it into the title of the high-level meeting. So that's a really amazing place to be. And I think really just shows how far we've come. So in 2018, the theme was also NCDs, but mental health was written into text for the first time. So we're now at the point where not only is it in the text, it is in the title as well. What this will be is essentially member states from across the world will come together and discuss, and they will then create this political declaration that member states will sign up to, which will hopefully lead to global system change.
Thank you. And has the head of the public affairs within mental health at Boehringer, how do you think a summit like ours can help governments implement those recommendations?
I think given the appetite for change from a global perspective, given that this is, as I sort of said, the first time this is being mentioned in the title, I think it really shows that there is an appetite for change. But there is only so much that governments and policy and decision makers can do. And there is a lot of, obviously, other global attention on other conditions. So what we really need to be doing at the moment, and I think this is where this summit is such an amazing opportunity, is to bring all of those patient advocates together and say, you know what, it's not one person, it's not one group, it's not one country. It is the global community that's calling for a redefinition of mental health and greater inclusion of mental health across the world.
This is wonderful. As a personal note, I think that mental health patient advocacy is very unique in the sense that there is very little competition. It sounds strange to say competition in patient advocacy, but in some fields and disease areas, there is competitions and the resources are scarce. And I think that in mental health, it's just amazing to see that organizations from all across the board are coming together and trying to break the taboo, because this year's UN high-level meeting was just a wonderful example of how the walls are starting to be broken. And also the tangible part, that we are really coming along and talking about mental health as integral part of healthcare and not anymore about like a black sheep of healthcare, like I felt for many years that even governments were treating it.
Yeah, absolutely. And I think, on that point, stigma is obviously still a huge part of what prevents people from reaching treatment and, even getting a diagnosis in some senses. And this isn't just for patients. I think globally in governments, they still suffer from the idea of stigma, and there's around, I think, 23 countries that still have criminalised suicide, which is another part of the political declaration that we're really supporting at Boehringer, is to really try and make sure that is destigmatised from the highest levels up, and that people are supported in all levels to get diagnosis, treatment and care.
Absolutely. And I'm seeing the change in stigma and taboos. When I first got diagnosed with PTSD, it was only 2 years ago, but my initial trauma happened 20 years ago. And back then I could not even seek medical attention, because if you did, it was such a taboo that people would stigmatize you and discriminate you in workplaces, study places, and so on. And now when I got my diagnosis, it's so normalized in Israel and also in Austria where I live, that I'm super... I don't know, it makes me so happy to see that mental health is becoming again kind of an integral part of healthcare and not just like this strange black sheep of healthcare, which I felt it was for many years.
Yeah, no, I'm really sorry that you had to experience that and the stigma around that. And we know that is something that people living with mental health conditions globally face on a daily basis. And I think this doesn't stop at an individual level. We know that there are around 23 countries that still have suicide criminalised, which just really goes to show that that stigma is not rooted in a community, it's rooted in the highest levels of government in those countries. So that is another call in the UN high-level meeting, is to decriminalise suicide across the world, which I think would be an incredible step if we can get to that point.
Absolutely. And I think religious leaders are also kind of very important stakeholders. I know I'm Jewish, and in the Jewish religion, like, suicide is also forbidden, even though secular people will not regard it as such. But I know that in many other beliefs, this is a strong part, and it's not only governments maybe that we need to talk to. I had an amazing honor to have a conversation with the late Pope Francis about mental health, and it's just incredible how the church itself is trying to destigmatize mental health. It's very exciting for me to see.
Yeah, no, definitely. And I think that just comes to all of it, that when we talk about the UN high-level meeting and when we talk about policymakers, we're also talking about decision makers, and those decision makers exist within the communities. They are those religious leaders, they are cultural leaders, they're those people that have an influence on how people that live their lives. And I think this is where we kind of want to get that top-down approach, but equally it's not good enough for it just to be a top-down approach. It also has to come from the bottom up, which I think is why it's so great to have all of these advocates in one space that form part of that base of that pyramid that can push up, as well as hopefully events and meetings like the high-level meeting also pushing down, so that at some point it reaches the people it's meant to reach and we can really achieve that change.
Absolutely. And I think this summit is a huge platform for change, because the people who come there as advocates and leaders do the change kind of on a daily basis. And it's not only about collecting insights or perspective, it's really about collaborating together.
Yeah.
And we are working very hard to plan it as such, to facilitate those voices and to bring the change to life, and not only to ideate on it. And I wanted to ask you, it's your first year that you're planning this amazing summit with us. Do you have already experiences, enjoyable moments, or something that you want to share about the process so far?
I am completely in awe of everybody who's organising this, because it's going to be such an incredible day, but these days do not happen by chance. I know that there's a great team working behind the scenes to pull everything together and make sure that everyone attending gets the best opportunities that they can. I mean, personally, I am a massive policy nerd, so I am really excited to hopefully really just pass some of that energy and some of that excitement on about what is actually achievable. And I think, it just goes to show that policy is not a singular issue, it's not a single person's issue. We have to approach it as a collective, and I think that's what's really so great about bringing everyone together in a space like this.
And it's really landing to my next question, because I wanted to ask you, if there is one thing that is like a take-home message from the summit you want the participant to take, what would it be?
I'd love to just sort of highlight that policy and change at both the highest levels is achievable. It might take some time and it might take some effort, but this is where, I'm just really excited to have everyone in the room and really just sort of highlight how achievable with the right tools it really is.
This is really interesting. And it's also connects a bit to the fact that we had in June the GPPS, the Global Patient Partnership Summit, and that you were attending. Is there any, they say it in German, a Faden, like a red threads that we can kind of link to our own summits as a takeaway from GPPS?
Something we've definitely been trying to do at Boehringer across all of our events this year. So from WHA, which is the World Health Assembly in May, through to GPPS, through to the UN high-level meeting, all the way through to this summit, is just to really try and bring out the individual stories and the individual opportunities that people have. and really sort of try and highlight that patient experience. So we very much try to bring the patient experience to the global stage. And I hope everyone agrees by the time they get to the summit that we have managed to achieve that. But I think that's really where we've tried to bring that red thread across.
Before we wrap up, I wanted to ask you if there is anything you wanted to add about the summit or about your own experience planning the summit.
I don't think there's necessarily anything I want to add other than just to, I guess, I feel like I've said it so much during this, but really just to highlight that change is possible. And I think if everyone brings the same energy that I know they bring to their everyday work and everyday advocacy, that we have a real opportunity to create this change. For example, there was, I think it was last year, there were conversations at the UN to try and just have the title of the meeting just on NCDs. And that's something, Boehringer worked with our collective community to really try and advocate for. And so we're so pleased that and mental health has been included. And I think it just sort of highlights that actually this isn't just our issue. It's not just one person's issue, but it's the global community is calling for this and is really sort of trying to seek that change.
I really agree. And I think that public policy has such a huge role coming from also the industry to really make the change we need around mental health, because eventually when we all sit in the same table and we discuss, things really change. I've seen it with my own eyes as a patient advocate, and I'm sure that this summit will have a lot of fruits that we can harvest in the upcoming years.
Yeah, I really hope so.
Thank you so much, Aileen. It was lovely chatting with you. This kind of conversation are the exact reason I'm doing this, and I'm so inspired that we can help change the mental health landscape together.
Amazing. No, thank you so much for having me, and I look forward to seeing everyone in October.
We look forward to see you there. And that brings us to the final episode of this mini-series. Thank you so much for being with us in the road to the Global Mental Health Community Summit. Whether if it was your first episode or you've been with us all along, it's been a pleasure having you here. Thank you so much. The summit is just around the corner and I seriously cannot wait for it to arrive. Don't forget to connect with us using the hashtag GMCS25. It might be our last episode, but it's only the beginning of what we can achieve together. I've been Roy Sternin, and I've been so happy being your host. Thank you so much, and see you in the most anticipated summit of the year. Auf Wiedersehen!